This flag raising sends a powerful message on World AIDS Day.
We not only remember those who've lost their lives to AIDS, but really honor and celebrate those who fought to get us where we are today.
And where we are today is a long way from where we were years ago, like in 1982, the year David Morse became positive with HIV. Treatments now available have allowed him to live normally.
People are living undetectable, untransmittable for normal lifespans.
Yet in some ways, experts say we're still a long way from where we can be. More than 3,700 people are living with HIV in Santa Clara County as of the most recent data available in 2022. But one group is being hit especially hard when it comes to new HIV diagnoses.
60% of these were among the Hispanic and Latino community. There could be a variety of reasons why we're seeing that, but probably one of the main reasons is lack of access to care because of cost or insurance purposes.
That demographic isn't just being disproportionately impacted in Santa Clara County. It's seen throughout the Bay Area and nationally, according to U.S. statistics. Dr. Maria Lopez is a pharmacist and president of Mission Wellness Pharmacy in San Francisco. In addition to insurance purposes, she says the disproportionate numbers can be traced to education access.
HIV prevention, what patients can do or individuals can do to prevent and protect themselves from acquiring HIV.
Lopez has been part of work that's increased education and resources throughout the state. Mission Wellness was the first pharmacy in California to provide medications that prevent HIV, like PrEP, directly to community members.
A demonstration project that was started in San Francisco with the health department and our site and has led to a state bill and a national model that is being expanded in other states.
Even with the advancements made, public health officials are fast to point out that there is still more work ahead.
World AIDS Day reminds us that the fight is not over, and we really need to work with the community to break barriers to access to testing and treatment.